So the abstract I'm presenting is a gene therapy study for cerebral adrenoleukodystrophy in children, which is a progressive neurologically devastating disease. So in this abstract, we compare the outcomes using two separate gene therapy trials, so open label, single arm trials, compared to patients who received allotransplant in the same period of time. The goal of that was to try to have the groups as similar as they could be to try to determine if there's a safety disadvantage or advantage to either therapy or even an efficacy change. What we found is that as far as efficacy, they're very similar. So the gene therapy trial compared to the allo-stem cell transplant was very similar, and the safety profile was different and the survival was different. So at 2 years in our comparative gene therapy trial, your survival was about 91% compared to 76%, or progression-free survival, I should say, in the gene therapy trial. So based on that, we feel very comfortable moving forward with gene therapy. There are important toxicities that we're thinking about, and so the acute toxicities were very similar to what you'd expect to see in patients treated with chemotherapy. So both groups got chemo. They both had similar safety profiles in that regard. In the allotransplant arm, though, you had toxicities of graft versus host disease and graft failure that were significantly, or very different, I should say, from those in the gene therapy, where there's no GVHD, no transplant-related mortality, and or treatment-related mortality, and no graft rejection. So difference in balance. The downside that we've seen, or that we're trying to explore right now in the gene therapy trial, is that there have been 3 patients who have developed myelodysplasia following that treatment, which is something that we're exploring and looking into to try to understand more. So the important, I think, the takeaway from this is that we saw major functional disability-free survival, so lack of devastating neurologic symptoms at 2 years, and met that endpoint greater than in the gene therapy trial compared to the retrospective trial. But we're not trying to argue necessarily that one is better than the other, but more that patients deserve to have a choice, and that gene therapy is a potentially attractive alternative treatment to allotransplant in this patient population.